Good afternoon, everybody, and thank you for joining us for a webinar program today about Virginia OSHA's new COVID-19 Emergency Temporary Standard. I'm very pleased to be talking about a topic near and dear to my heart, that is the goings-on of the great Commonwealth of Virginia. I was born in Newport News and raised in Newport News and Williamsburg and spent a lot of years in Charlottesville between college and law school. And so I'm delighted to be joining you all today to talk about all things Virginia. I'm also very pleased today to be joined by a couple of special guests, a great consultant, industrial hygienist and certified safety professional with Safety Resource Associates, and a real special guest to be joined today by Jennifer Rose with Virginia OSHA. We've got a lot of ground to cover today and not a very good track record of finishing on time. So we're going to dive right in. Our agenda today is to cover really all things related to COVID-19 and the Emergency Temporary Standard in Virginia. Get into a little bit of background, how this came to be, how it is that Virginia has this new standard on its books, what is in it, what does it require of Virginia employers, and then cover some of the key deadlines when things, as this rule is rolling out right now, when things have to be implemented, when they have to be done. And then we'll get into some practical side of the presentation, some tips and strategies about infection control plans that are now required for many, or really for every employer in Virginia, written exposure control plans required for many employers in Virginia, and then some other practical tips and strategies for what we're seeing in the field for those essential businesses that have been operating since the pandemic began, and others that they're experiencing as they move into reopening or expanding their on-site activities. The first faceless voice that you're hearing today is Eric Conn. I'm one of the founding partners and the chair of the National OSHA Practice Group at Conn, Maciel, Carey. I practiced for 11 years at the beginning of my career alongside the former first general counsel of the OSHA Review Commission before starting my own OSHA defense practice at a large national employment law firm before starting my own law firm 6 years ago. We celebrated our celebrating our 6-year anniversary next month, and we have now grown to almost a 20 attorney, 5 office law firm around the country. My practice now for 20 years has focused on all aspects of occupational safety and health law, working with employers through inspections, investigations, enforcement actions, and day-to-day compliance activities involving OSHA, all of the state OSH plans around the country, Chemical Safety Board, and the other alphabet soup of agencies involved in workplace safety and health. Today, and the last several months, I thought I had a really super specialized practice focusing on OSHA law. It has become even more specialized the last few months, really a COVID-19 OSHA lawyer. I co-chair our firm's COVID-19 task force and have worked with employers through the full range of hazard assessments, responding to employee complaints to OSHA and interactions with OSHA in that regard, inspections, developing written infection and exposure control and response plans. You name it, we're fielding tons of questions about record keeping and reporting, helping employers manage this crisis, and it's been a around-the-clock activity in that regard. So I'm going to kick us off today and talk a little bit about the background of this rule, how we got here, and let's jump right into that. The background is that federal OSHA, that the state plans often will look to for guidance on how to manage a new issue, a new crisis, a new area where there may be rulemaking necessary, or often following suit when Fed OSHA promulgates a new rule. In this instance, Fed OSHA has been, to say the least, reluctant to delve into the rulemaking process. And they have been widely criticized by the print media, by organized labor, by the news media, by television. We've got some headlines here from the New York Times and the Washington Post. Protecting workers from coronavirus. OSHA leaves it to employers. In other words, they've not promulgated a mandatory standard. Instead, have opted for lots of guidance. And there's a really good justification for that. The agency has acknowledged that there's a lot to learn about this hazard, about this new crisis in the workplace. And guidance is a good approach when the seas are shifting as much as they have been with this virus. And I will commend federal OSHA for the guidance that they have issued. Some broad, generally applicable guidance for workplaces, as well as numerous instances of industry-specific guidance, and some more detailed than others and more valuable than others, but they have been very active in that regard. And now they're out there for sure with lots and lots of open enforcement inspections from the framework, they say, of our general duty clause and respiratory protection standards, sanitation standards, PPE standards. They believe they have what they need to enforce conduct of employers with the tools they have available. But that has not stopped Democrats in the House and in the Senate from blasting OSHA's response to this and trying to navigate through the legislative process to compel OSHA to promulgate a mandatory standard, an emergency temporary standard. So far have not had success getting that done. And so organized labor stepped in and actually sued the agency. They petitioned first for an emergency temporary standard to FedOSHA. That was denied. And they actually sued the agency to try to force them to promulgate an emergency temporary standard. That suit was dismissed in federal court. And so FedOSHA is where they are. Lots of guidance. And to the extent there will be enforcement, it's going to be in the context of general duty clause, respiratory protection standard, we're sure lots to see in record keeping and reporting. So Virginia stepped in on the next slide here and said, that's not good enough for us. And Governor Ralph Northam has talked about, Virginia being a leader in this regard. And here he is, a quote, as they were announcing the final rule that workers should not have to sacrifice their health and safety to earn a living. That's true anytime, but especially during an ongoing global pandemic. In the face of federal inaction, this is why Virginia OSHA has stepped up. In the face of federal action, Virginia has stepped up to protect workers from COVID-19, creating the nation's first enforceable workplace safety requirements. Now, the reality is that there's governor's orders and health department orders all over the country, and there are enforceable requirements in FedOSHA states through, as I said, the general duty clause and other standards. But Virginia really is the first state in the nation to have a COVID-19 specific mandatory set of requirements and an emergency temporary standard. On the next slide, we'll talk through just a tiny bit about the process, how we got here. The Virginia Safety and Health Codes Board, very, I think, efficiently over, it seemed like only about a month or so of serious activity putting the rule together with, despite the fact that it's emergency temporary standard, that is not the normal rulemaking process. There were opportunities for feedback from industry, from employee groups as well, and lots of public meetings and interaction on this, and lots of the evolution of a draft standard until ultimately on July 15th, the Codes Board adopted Section 16 VA C25-220, which is the Emergency Temporary Standard, Infectious Disease Prevention, SARS-CoV-2 virus that causes COVID-19, an emergency temporary standard with mandatory requirements about this particular pandemic. That rule, after being finalized and adopted by the Codes Board, became effective the day that it was published in a paper of general circulation in Virginia. That was the Richmond Times-Dispatch a week ago today, and it became effective immediately with rollout dates that Jennifer is going to get into. So know that we're 1 week into triggers for things like a hazard assessment, written exposure control plans, training that all have a 30 and 60-day rollout period. We're a week into that now. The emergency temporary standard applies to every employer and every place of employment within VOSH's jurisdiction. So there will be some federal enclaves, military bases, federal property that are not covered by VOSH generally. They would also not be covered by this particular VOSH standard. And there's a couple of other carve-outs there, like for public education institutes that have plans that are approved by other bodies within Virginia. But otherwise, this applies to essentially every employer in the Commonwealth. It will run for 6 months unless one of several things happens. It will automatically expire within 6 months of July 27th. unless it is repealed sooner by the Safety and Health Codes Board or the expiration of the state of emergency, right? This is an emergency temporary standard based on a state of emergency declared by the governor about the pandemic. If that, we magically get a vaccine and it is effective and people are taking it and we no longer are in a state of emergency, then this rule would no longer apply. What's more likely to happen, in fact, what's already underway, is that the rule would become ineffective, inapplicable, if it is replaced by and superseded by a permanent infectious disease standard. And Virginia is already working on that. And that will not be an emergency rulemaking process. That will run, it will be very quick, but it will run the ordinary rulemaking process in Virginia, where there will be more opportunities, more formal opportunities for stakeholder input. So look out for that if you have interest in participating in that process. And with that, I'm very pleased to hand the microphone over to Jennifer Rose with the Virginia Department of Labor and Industry. And I'm going to let Jennifer tell you about herself and get into the guts of the rule, what it requires of employers in Virginia.
My name is Jennifer Rose, and I'm the VOSH Cooperative Programs Director for the Department of Labor and Industry. I have a little over 16 years of experience with the department, including various field positions as well as management positions. I am a certified safety professional and a graduate of Virginia Tech, and I also have my master's degree in safety and health. Today I'm going to be speaking to you about the new regulation for COVID-19. The reason why we have a new regulation is in order to prevent the spread of the COVID-19 virus. The new standard applies to every place of employment that has jurisdiction by VOSH. This includes all employers with one or more employees, as well as the general industry, construction industry, and public sector employers. The main things that you need to think about when you're looking at who this applies to is when you figure out the risk level for each of your employees. And this is going to be based on the hazards that they are exposed to when they do their job tasks. And the standard takes a tiered approach to provide employee protection against COVID-19 hazards. And the job tasks depend upon what exposure risk level that you're exposed to. There are minimum requirements that apply to all employers, but then there are enhanced requirements that apply to the medium, high, and very high risk exposure employees. We're going to talk about taking actions every day to help prevent the spread of COVID-19. As you all are aware, there are several protections that employees can use to protect their employers, or employers can use to protect their employees on the job site. One of them obviously is social distancing, that distance of keeping a 6-foot distance away from others. And in the standard, we'll talk about it, the standard refers to it as a physical distancing, but just be aware that that means the social distancing. You want to make sure that you encourage self-monitoring for your employees, making sure that they're looking for symptoms, and if they have symptoms or are sick, they need to stay home. There are requirements to post signs, and this is to let your employees know to report symptoms, what they need to do as far as following a plan, and how you've designated that they are to be protected. We're also going to look at protecting your employees by using PPE, and this is going to be determined based on what exposure risk level your employees have to determine what PPE is appropriate. But we'll get into all of that as we go through the presentation. You want to make sure that you're providing access to hand sanitizer, soap, and water, and that you train employees. One of the things you also want to consider is not only protecting your employees, but other employees that might be on your site, including contract workers, temporary workers, and subcontractors. We'll talk in detail about the different exposure risk levels. Lower risk jobs are those that do not require contact inside 6 feet with persons known to be suspected of being or that may be infected with COVID-19. These individuals have minimal occupational contact with other employees or the general public, or could achieve minimal occupational contact through the implementation of work practice controls. These would include engineering controls and administrative controls such as barriers and teleworking. Just the use of face coverings is not sufficient to meet the requirements for achieving minimal occupational contact. The next category is minimum risk. Job tasks that require more than minimal occupational contact inside 6 feet with other employees or persons or the general public that may be but are not known or suspected to be infected with COVID-19. These may include, but are not limited to, waiters, grocery store workers, construction workers, hairdressers, fitness instructors, those that work in the food processing industry, manufacturing workers, and any healthcare workers in settings without known or suspected sources of COVID-19. High-risk jobs are jobs that have high potential for employee exposure inside 6 feet, and this is exposure to known or suspected sources of COVID-19. These would include hospital workers, first responders, medical and dental staff, mortuary service workers, and any non-medical support staff that may be exposed as well. Very high-risk jobs are those with a high potential for employee exposure inside 6 feet to known or suspected sources of COVID-19. These include individuals performing specific medical procedures that would generate an aerosol, things like intubation and certain lab techniques. So how do you determine what exposure level your employees are exposed to? Some of the factors that you want to take in consideration are the job tasks. What exactly is it that your employees are doing that they could be exposed to COVID-19? You want to look at the work environment. Are you in an office setting, a manufacturing setting, or do you have employees teleworking? You want to look at the presence of the virus. Have you had previous outbreaks at your site, or do you have a high absentee rate due to employees having symptoms? Other factors to determine your exposure risk level would include the number of employees and the size of the area where those employees are working. If you have close quarters, obviously you're going to have an higher exposure risk level than those that may have a spread out work environment. You want to look at working distances. Again, can employees do their job 6 feet apart from one another, or do their job tasks require them to be within closer contact? Duration and frequency of exposures. You want to look at what kinds of shifts you have. Are all your employees on one shift, or do you stagger the shifts to prevent the higher risk of exposing more employees to the hazard? And then we look at other things that the employees might be exposed to in the workplace. These could include things like procedures that create airborne transmission or any contaminated surfaces. The very high, or medium exposure risk categories require certain things. Basically, they have to make sure that you enable each employee to recognize the hazards of the SARS virus, as well as any signs and symptoms of COVID-19 disease. This would include training each employee in the procedures that they must follow in order to minimize the hazard. The training must include requirements of the standard, the characteristics and methods of spread of the virus, risk factors, how the virus is transmitted, and safety and health work practices such as distancing, disinfecting surfaces, using non-contact methods of greeting, things like that. Other things that employees in these very high, or medium risk levels must take into consideration is PPE. When are you going to require it? What are you going to require? And making sure that your employees are trained in the correct use of those and the care of those, as well as any limitations. Your employees need to be aware of the fact that face coverings have certain limitations that other medical masks and respirators may not have, so they might not be as useful in protecting against the virus as those other things. Very high, or medium risk levels, as well as the lower risk levels, have to make sure that your employees are aware of an anti-discrimination component of the standard. You cannot discriminate against employees who express concerns about their health or safety. And this is not new to VOSH standards. This is actually would apply just the way it would with any other hazard, with employees expressing their concerns. Basically, employees need to make sure that they feel comfortable going to their site management when they have concerns about their health or safety. And then the last requirement for very high, or medium risk levels is that the employer has to develop an infectious disease preparedness and response plan. And we'll go into detail what's required in those plans at the end of this presentation. The requirements for infectious disease plans include things like having sick leave, telework, staggered shifts, and informing employees of policies, including the Families First Coronavirus Response Act. While the Department of Labor and Industry doesn't enforce this act, it is enforced by the Federal Department of Labor and Industry, but you do just need to make sure that your employees are aware of the act and make sure that they understand the availability of that paid sick leave because of COVID. You want to make sure that the policy and procedures have been developed on self-reporting and monitoring. You know, what's the system that your employees use before they get into the site? How are you monitoring those symptoms from entering into the site, as well as how employees are to report any symptoms that they may experience. You also want to have a system in place for reporting positive results. Is it through chain of command, or do you have a medical health staff that would be the ones to report that? And you want to make sure also that you have a policy in place to notify of any positive tests to all those employees who may have been exposed to that. One of the important things to remember in the notification requirements is that building or facility owners must notify all employer tenants in the building that one or more cases have been discovered. And they also have to inform those tenants of the floor or work area where the case was located. They do not have to identify they don't have to identify the individual names or anything of the positive tests, and that will be kept confidential in accordance with the requirements of ADA and any other applicable federal or state regulations. In determining the employer's exposure risk level, it starts with a PPE hazard assessment. To the extent feasible, employers shall provide face coverings to non-employees suspected to be infected with COVID-19 until they are able to leave the site. So again, we're not only talking about doing a hazard assessment on your employees, but also any people that may coming from the public or subcontractors that may be on your site. So with a PPE hazard assessment, the point is to assess the hazards and determine what controls you're going to put in place to make sure that your employees that hazard exposure is lessened. Looking at PPE, you want to make sure that that is a last resort before or after you've applied any engineering or administrative controls. And when you do finally select the PPE that employees are required to use, you want to make sure that you provide training for how to use it, clean it, store it, and how to get the best fit. There are 7 steps that employers can use to perform a PPE hazard assessment. Step 1 is to inform affected employees of the process. Affected employees from each work area that is being assessed should be involved in the process. You want to discuss the reasons for the survey and the procedures being used for the assessment. Review the job procedures and the potential hazards with employees, and make note of any PPE that they are currently using. Step 2 is to review the data. You want to look at any reports of work-related illnesses or reports of employees having symptoms or testing positive. And you want to take these data and make sure that you incorporate them into your assessment. Step 3 is to conduct a walkthrough survey. The purpose of the survey is to identify any sources of hazards to employees. You want to observe the following: the layout of the workplace, the location of employees, what work operations they are performing, the hazards that they may be exposed to, and places where personal protective equipment is currently being used and what the reasons are for that use. Step 4, you want to determine the hazard risk level. Using the definitions in the standards, you would select the appropriate risk level for, remember, those 4 categories, either very high, high, medium, or lower. Again, the very high exposure risk are job tasks where employees are exposed with high potential for exposure to known or suspected sources of COVID-19. And this would typically be in the medical field during specific procedures. High exposure risk are jobs that have high potential for exposure inside 6 feet. Again, this would include things like delivery of healthcare, any support staff, medical transports, and mortuary workers. Medium exposure risk are jobs that require more than minimal occupational contact inside 6 feet with other employees or the general public who might be infected. Some examples of medium exposure risk sites would include schools, any high population density work environment such as food processing or manufacturing, or any high volume customer retail settings, grocery stores, restaurants, bars, and the like. Those lower exposure risk level jobs are jobs that do not require contact inside 6 feet with persons known to be or suspected of being or who may be infected with the SARS virus. Employees in this category have minimal occupational contact with other employees or the general public, such as in an office building setting, or they are able to achieve minimal occupational contact through implementing engineering, administrative, and work practice controls. Some examples of this would be employees that work remotely. Obviously, if they're teleworking, they're not being exposed in the workplace. Other examples are office workers who do not have contact inside 6 feet with coworkers, customers, or the public, as well as any manufacturing or industrial facility workers who do not have to have inside 6 feet contact with coworkers, customers, or with the public. Step 5 in performing the PPE hazard assessment is to determine the controls that you will implement to protect your employees against COVID-19. After considering or planning for the engineering and administrative controls, you want to select the personal protective equipment which provides at least the minimum level of protection required to protect your employees from the hazard. There is a form available on our webpage that has a template on how to perform an assessment with directions, as well as a template on the actual documentation of the assessment. And I'll give that link at the end of the presentation. Step 6 is that once you've created the document of the assessment, you want to make that document accessible. Once you've completed, signed, and dated it, you want to make sure that you store it either electronically or as a hard copy in a location where employees can easily access it. Step 7 is to reassess the workplace as necessary. If you bring in any new equipment or change work processes, you want to make sure that you reevaluate that. If you have accident records, where you have employees that may have been exposed, or you have employees that are testing positive, you want to reassess that, assess that PPE hazard assessment to see if any changes need to be made. Here's a screenshot of the PPE hazard assessment that is available on the Department of Labor webpage. You'll see in the far left is your area where you'd select what exposure risk level your employees are exposed to. You need to write in the description of the hazard, what exactly is it that they're doing that would expose them to the virus, and then any engineering or administrative controls that you have put in place to protect your employees from the virus, and then lastly, any personal protective equipment that you have chosen to put your employees in. And you'll notice that at the top of each section, there's a blank for job tasks, either employees or job categories. So the PPE hazard assessment doesn't necessarily have to be employee specific. If you have multiple employees that may be exposed in the workplace, you can categorize that as certain job categories or employees that do a certain job task. You can group those and not have to do them individually by the employees. But there are several spaces on there on the hazard assessment which allow you to include all of the different job tasks that you have employees doing at your work site. We'll talk a little bit about social distancing. And again, the standard refers to this as physical distancing. You want to make sure that employees observe physical distancing at all times on your property, including policies and procedures that use verbal announcements, signage, or visual cues to promote physical distancing. You also want to look at decreasing work site density by limiting non-employee access to the place of employment or restricting access to only certain areas to reduce the risk of exposure. You want to look at access to common areas, break rooms, or lunch rooms. And if you can control access to those, limit occupancy, things like that. In common areas, you want to make sure that employees are required to clean and disinfect the immediate area in which they are located, or the employer may provide cleaning and disinfecting at regular intervals through a housekeeping process. You also want to make sure that those common areas make available hand washing or hand sanitizer available to their employees. Some requirements for common areas. The standard does require that a posting be posted at the entrance of those common areas that includes the 4 things listed there: the occupancy of the space, the physical distancing, statements about washing hands or using hand sanitizer, and statements about cleaning and disinfecting of shared surfaces. For the occupancy of the space, you want to look at what procedures you have put in place in those common areas. Are you limiting the occupancy, or are you segregating off certain tables where employees can't use? Things like that that would alter the number of people that can go in there, and to make sure that you're meeting those physical distancing requirements. So that is required to be posted, those 4 things, on a posting outside the entrance of any common areas. When we talk about cleaning surfaces, you want to make sure that you're cleaning and disinfecting any high-touch areas. These would include things like light switches, door handles, stair rails. Also, in those common areas, you want to look at things like vending machine buttons or microwave buttons or refrigerator handles, anything where you'd have a potential for lots of employees touching those areas. On the EPA webpage, they have a list of disinfectants that are suitable against the SARS virus, and you can look on there. There's several name brand products that are on there that the EPA has determined that are good in using for disinfecting the areas. When we talk about what employees are wearing, again, the choice of either having employees in face covering, surgical masks, or respirators is going to depend upon what hazard exposure level they're exposed to that you've come up with in that exposure hazard assessment. And the last requirement in the standard is for an infectious disease preparedness and response plan. Employers in the exposure risk levels very high and high must develop a written infectious disease preparedness and response plan. For those in the medium risk category, if they have 11 or more employees, they must develop and implement a written plan. The plan and training requirements tied to the plan will only have to be presented to the employees classified in that very high, high, and medium section. One of the requirements for the plan is to designate a person who's going to be responsible for implementing that plan. The person should be knowledgeable in infection control, the requirements of the standard, and any job tasks that your employees are doing at your work site. The name and the title of the person responsible for administering the plan must be included in the written plan. The plan also must provide for employee involvement in development and implementation. The same reason that we talked about with employee involvement in doing the hazard assessment, you want to make sure that you have opportunities for employees to be involved in the development of the plan. After all, they are the ones who are doing the jobs on a regular basis and have a large knowledge of what it is they're being exposed to. The plan should also consider and address the level of risk associated with the various tasks involved as your place of employment. The plan must contain where, how, and to what sources of the virus might employees be exposed to at work, including from the general public, any customers, or other employees that are known or suspected to be infected with the virus at that high risk level. You want to also look at any situations where employees work more than one job with different employers and encounter hazards or engage in job tasks that present a very high, or medium level exposure risk. As permitted by law, including HIPAA, employees have to identify those employees with individual risk factors and make sure that they are included in the response plan on how you will address employees with those risk factors. Engineering, administrative, work practice, and personal protective equipment controls necessary are required to be included in any written plans. The written plan must also identify basic infection prevention measures that need to be implemented. These would include promoting frequent and thorough hand washing, including not only by your employees, but also customers, visitors, or the general public that may be present in your workplace. And note that if soap and running water are not immediately available to them, you need to provide hand sanitizer. The plan should include how you're going to maintain regular housekeeping practices. This would include routine cleaning and disinfecting of surfaces, equipment, and other elements in the work environment that may become contaminated. The plan should also establish policies and procedures for managing and educating visitors to the place of employment. So we're talking about not just covering the employees at your work site, but those visitors that may be entering into the site as well. When writing your plan, you want to consider any contingency plans that might be necessary in case of outbreaks. You want to look at the potential for increased rates of employee absenteeism, the need for physical distancing or staggering work shifts, or even delivering services remotely, or other exposure-reducing workplace control measures. You want to look at any options for conducting essential operations with a reduced workforce. Things like cross-training employees across different jobs in order to be able to continue operations or still continue to deliver service with less employees. You also want to look at the possibility of having an interrupted supply chain or having delayed deliveries that may impact how you perform your essential operations. The plan shall also provide for the prompt identification and isolation of known or suspected to be infected with the virus employees away from work, including procedures for employees to report when they're experiencing symptoms or COVID-19. You want to address the infectious disease preparedness and response with outside businesses as well, including subcontractors or any temporary employees that you may have working at your site. The plan shall identify the mandatory and non-mandatory recommendations in any CDC guidelines or Commonwealth of Virginia guidance documents that the employer is complying with in lieu of the provisions of the standard. If you are going to go this route and comply with the CDC guidelines, you are required to inform VOSH of what CDC guidelines you're complying with, and then it'll be up to the agency to look at determining whether or not those are at least as equivalent as the requirements in the standard. The plan should also ensure compliance with any mandatory requirements of any applicable Virginia executive orders or any public health emergency orders, such as the requirements for the public to be wearing face coverings while in retail areas and dining establishments. So all these should be included as part of your written response plan. Some important dates to remember with this emergency temporary standard. It came into effect on Monday, July 27th. And there are requirements in the standard for infectious disease preparedness and response plans. And those take effect 60 days after the effective date, which is September 25th. And then there's also requirements for training your employees. And this has to be done within 30 days of the effective date, which will put you at August 26th. This emergency temporary standard will remain in effect for 6 months. And Section 20 of the standard provides that the temporary standard will expire within 6 months of its effective date or upon expiration of the governor's state of emergency. During the 6-month period that the emergency temporary standard is in effect, the Safety and Health Codes Board is considering the adoption of a permanent standard that may replace this emergency temporary standard. I've included here several links if you have any questions. First is the link to our consultation services. We do offer free consultation services to small employers in the state. Basically, you can request a consultation service from one of our local consultants, and they can either come out to your site, or right now we're doing virtual visits, and they can look at any written programs or policies that you might have in place and also help you with any training needs. I've included my email address there if you have any questions about this presentation. And then also the link for our COVID-19 webpage. And this is where you can find all of these documents that I referenced, including a template infectious disease preparedness plan, as well as templates for the hazard assessment and training PowerPoints. The agency has set up a dedicated email address for COVID-19 questions, and you can see that there. COVID-19 questions at dolly.virginia.gov. And this is staffed by myself as well as several program directors who can get back to you on if you have any questions about COVID-19. And then lastly, I'll include a link there for any employee complaints. If your employees have complaints or concerns of their exposure in the workplace, they do have the right to file a complaint against the employer, and that uses our standard complaint process where there's a format on the federal OSHA webpage that gets submitted and then sent in to Virginia. So that's all that I have for you today, and thank you for the opportunity for me to present this information to you.
Thank you so much. The rest of the program today, I wanted to cover a couple of unique aspects of the rule itself, and then some practical issues that we've been experiencing, myself and Susan Wilcox, the CSP who's joined us today, can share about sort of from the field practical issues we've experienced implementing effective infection control procedures. So I wanted to start off with a big component of the rule, of this new rule in Virginia, is a requirement to develop and implement for many employers a written exposure control and response plan. I think it's called an infection control plan in the Virginia rule. I would say, regardless of whether you are in one of those very high, or medium category workplaces or job tasks in workplaces that trigger the requirement to have a written infection control plan, I've been telling my clients and employers all around the country, regardless of a requirement to have a written plan, I think that's the most important thing that every employer can and should be doing to address not only the hazard, but all of the tertiary impacts of the risk of this pandemic and crisis in our workplaces. There are 4 really important reasons that I think every employer needs to have a written exposure control plan. And now in Virginia, we'll make it a 5th. One is, in Virginia, if you trigger one of the requirements, you're obliged to have the written plan. But there's really 4 other reasons why I think everyone should have one, regardless of the category that you're in from your hazard assessment. The first is your employees are naturally afraid, right? There's an incredible amount of anxiety. There's an incredible amount of stress about, is it safe for me to go into the workplace right now? Because, everything I read in the papers, everything I see on the news, on the internet, is about how this thing spreads so easily. These numbers, they're very scary. I don't want to go to work. I don't think my employer has done enough, or I don't know what my employer has done to address the hazard. So there's an extraordinary amount of refusals to work all around the country right now. Jobs being abandoned, or employees saying, I don't want to work because I don't think it's safe, and then retaliation claims following that. So to avoid those refusals to work, to avoid those retaliation disputes for claiming that an employee has abandoned their job by not returning to work, and to reduce employees complaining to VOSH about the response that employers have made to the pandemic, is to have a tangible, clear, comprehensive written exposure control plan that you can show your employees, put into their hands, so they can see you've put a lot of thought into this, that you care, that you have recognized and adopted CDC and OSHA guidance and VOSH guidance and the elements of this rule. It's all right there in paper. We all feel much more comfortable. You're going to cut down those refusals to work, cut down those retaliation disputes, and cut down employee complaints to VOSH. Second really important reason to have a good, clear written exposure control plan is avoiding those interactions with VOSH. But if you have to have them with VOSH or federal OSHA or any other state plan, because an employee has complained, or because you've had cases that have to be reported, or because a retaliation dispute has arisen, the Exhibit A of your response to the agency saying, we got this complaint, is it valid? What are you doing to address it? To be able to demonstrate and show the agency, here's our written exposure control plan. It's thorough, it's thoughtful, it follows all the elements of your rule, all the applicable CDC and OSHA guidelines, and here it is. So it's a great tool to show your employees. It's a great tool to show the agencies to hopefully stave off an inspection and close the file on employee complaints. And I'll tell you, I think we're approaching, or maybe even exceeding now, 30,000 employee complaints about employers' response to the COVID-19 hazard all across the country in state OSH plans and federal OSHA. So it is very likely, very foreseeable that you'll be having interactions with the agency about your response to this hazard in the workplace. Having a good, clear, thoughtful written plan is going to be a great way to control that, that communication, that dialogue with the agency if you have to have one. On the next slide, there is the tidal wave of personal injury, wrongful death, and public nuisance suits that I say here waiting around the corner, but they're not really waiting. There's already been hundreds of these filed all around the country. This, clear, comprehensive written exposure control plan will be Exhibit A to show that you have met that reasonable person standard, that you've met the standard of care as an employer controlling, the safety environment in a workplace. Here's, how we followed the CDC guidance, followed OSHA guidance, followed VOSH guidance, and VOSH's new rule. Having that written plan is going to be very useful in that context as well. And then finally, of course, I put this forth, really should be first, is it works, right? Having a very thoughtful response to any hazard in the workplace is going to be the most effective way to mitigate the hazard. And by mitigating the hazard here, that means mitigating the spread of COVID-19 in your workplace. And if you're mitigating the spread in the workplace, you're accomplishing a lot of things. One is you're not going to be experiencing these huge headaches with managing availability of employees, managing workflow, managing staffing, because your employees won't be out with these lengthy quarantine periods, and they won't be out with experiencing symptoms of an illness, and you will be able to maintain operations more effectively if you have a more effective infection control program. Avoiding either shutdown because of availability of employees or shut down by health departments, or VOSH and OSHA have shutdown authority, rarely used, but much more likely to see that in interactions with the health department. They have extraordinary authority and power during a public health crisis. And we have seen a lot of this around the country where employers are not following governor's orders, not following OSHA and CDC guidance, and the health department will shut that business down, at least temporarily, until you can demonstrate that you are following that kind of guidance. And then avoiding extra scrutiny, right? The more cases you have, the more spread you have in the workplace, the more scrutiny you're going to have from VOSH, from OSHA, from the health department, other agencies, because they're going to find out about it, right? The health departments are hearing about this essentially in real time through notifications from testing sites, from hospitals, and now under this VOSH rule with some notifications that employers have to make. You're going to be dealing with regulators in your hair a lot more often if you don't have effective exposure control strategies, and a good, thoughtful exposure control plan is going to lead you right to those thoughtful strategies. And then finally, reducing your injury and illness rates. There are going to be COVID-19 related cases that are going to end up on your 300 logs, that are going to end up in your workers' comp system, and they're going to have big effects on you in lots of different ways. Bidding on contracts, attracting and retaining talent, employees, dealing with your workers' comp insurance. Your rate modifiers can be affected by DART rates and things like that. So avoiding infection spread in the workplace is going to be extremely beneficial, extremely positive for your business and for your operations and for your bottom line. So those are all the reasons that we've been pushing, even before this standard, pushing really hard for all of our clients to do that hazard assessment and develop and implement that written exposure control plan. So now add one more reason to the list. VOSH requires it. So that's, to me, a really good aspect of this rule if it drives employers to do something that I think that we all should be doing in any event. On the next slide, talk about a couple other unique aspects, some unique and some not unique aspects about the VOSH ETS, and that is notifications, record keeping, reporting, all about what you do after you have a positive case in the workplace. There are some Virginia unique notifications now that did not exist before this emergency temporary standard and don't exist outside the Commonwealth of Virginia. And that is, in some states have this now through health department orders and such, but as a general rule, there has not been a duty on employers to notify the health departments around the country about positive cases. And generally, the reverse is true. You're hearing about it from health departments, often before you hear about it from employees, often before you even know about it. But now under this emergency temporary standard, positive cases in the workplace are required, trigger a notification requirement from the employer to the Virginia Department of Health, the applicable local, I guess this is the state level Department of Health, within 24 hours of when you learn about the positive case. Another really, really important new requirement under this Virginia emergency temporary standard that I don't think exists in any other state is a duty to require the for the employer to notify the Department of Labor and Industries, basically to notify VOSH within 24 hours of when the employer learns that 3 or more employees in the same workplace have tested positive within a same 14-day period within that workplace. So one of the things that's interesting about this, and we're looking to get some answers about it, and I don't know if Jennifer is still on or if she knows the answer to this, I don't see any link in that language of the standard to work relatedness, right? So we immediately fall back to, if I'm notifying VOSH, just like I would for other hospitalizations, other serious incidents or deaths, those all have a work relatedness component to it. I don't see anything in this rule that triggers a work relatedness component. In other words, a requirement that you conclude that these 3 or more cases are work related. Instead, it just says 3 employees who happen to work in the same workplace, if they test positive for COVID-19 during any 14-day period, then that is a requirement, a notification you're required to make to VOSH. And I don't see a work relatedness component, and that may be that VOSH wants to know about these so they can evaluate potential hotspots, potential clusters, and make their own work relatedness determination. But that's again, an interesting element of this rule to pay attention to, because it's different than everywhere else in the country, and a duty that may even be reporting for non-work related situations. Jennifer actually talked about a couple of these others. I wasn't sure she was going to in her slides, but there are a few other notifications that are required under the rule. Those are notifications to your own employees when one of your employees tests positive. That's generally been required, at least under all the guidance out there, is notifying your workers about potential exposures that they've had. One thing that's new about this is that there's a deadline that you have within 24 hours of your learning of a positive case in the workplace that your employees may have had an exposure to, that you've got 24 hours to make that notification to the employee, to your employees. And again, make sure that those communications, you're doing the best you can to maintain the confidentiality of the employee who has tested positive. That's very often going to be hard to do. It may be obvious in many instances who the worker is, but you should at least be not saying the employee's name who is the sick employee, to protect, to the extent you can, the confidentiality, their ADA protected confidentiality about their illnesses. You also have a duty to notify other employers who may have had employees exposed to your confirmed positive employee. Same 24-hour period. This is not a duty to individually notify other employers' employees, but you have to notify contractors, vendors, co-tenants, things like that, where there are other employers who may have had employees exposed. Notify them about the positive case involving your employee, location, general information that they can use, the other employee's employer, that they can use to notify their employees about potential exposures. And then Jennifer did talk about the requirement for building owners, facility owners to notify other employer tenants who may have had exposures because of someone else testing positive in the workplace. So lots of new communications, new notifications required under the rule. On the next slide, though, we'll talk about what's not new and what's not different, and that is record-keeping requirements, recording COVID-19 positive cases. And the reason why there's nothing new and different in this rule about that is that the law does not allow state plans to deviate from federal OSHA requirements on record keeping. It is the only regulatory requirement that the state plans are not allowed to be more rigorous, not allowed to deviate in any way. There is a requirement under the FedOSH regulations that says that all state plans must have the same criteria for recording and how to record injuries and illnesses. And so if you're looking to understand in Virginia, how do I know if I have a COVID-19 case that has to be recorded on my 300 log? I would recommend that you go to OSHA's guidance on COVID-19 record keeping. And what they've said about that is 3 criteria for that case to be recordable. It has to be a confirmed case. And confirmed case means, according to OSHA, that it is at least one respiratory specimen that is tested positive in a lab-based test for the active virus. So without a confirmed case, it cannot be recordable. Even if you've got a medical diagnosis, subjective diagnosis by a medical professional, treatment consistent with COVID-19, self-diagnosis, none of that is good enough without a confirmed positive laboratory test. The other 2 requirements, one is that it has to meet one of the general recording criteria. If you have a positive test for COVID-19, then you're going to meet one of the general recording criteria, because quarantine, days away from work for quarantine, when there is a confirmed case and an actual illness, counts as days away. So that's going to be basically an automatic trigger. If you get that confirmed case, that those employees are going to be out for days away from work. So that's going to be met, that second criteria. The third criteria, though, is the big one, work-relatedness. How in the world are you supposed to tell whether someone who contracts an illness that is everywhere, that is invisible, that is ubiquitous, that is work-related? On the next slide, we'll see some guidance that OSHA has given. They have acknowledged and recognized how extremely difficult it is to determine that a case of COVID-19 is work-related. So the standard is that it is more likely than not that the exposure that caused the illness was an exposure that occurred in the workplace in connection with work. So more likely than not is the standard. And how in the world do you determine if it's more likely than not? Well, they give a little extra criteria. They say, we don't expect you to undertake extensive inquiries. You can rely only on reasonably available evidence. And even if you find circumstances that are potentially more likely than not to be work-related, like a cluster of cases in the same workplace among employees who had close contact, or cases involving a positive test shortly after a long-term exposure to a coworker who it turned out was already infected and maybe didn't know it at the time, or if you've got job duties that are general public facing, you have regular and frequent contact with the public, all of those things are on their own potentially more likely than not to be work-related. But something that takes the legs out of that work-related determination is any other non-work alternative explanation for the exposure. So if there is a cognizable, recognizable, known potential non-work exposure that makes it just as likely that that was the cause of the illness, that will undo any finding of work-relatedness. So if your employee is taking public transportation to work, they have another resident in their home, the spouse or a child who's tested positive around the same time, and it could have been that they tested positive first. Your employee works another job. If your employee acknowledges having spent some social activities, 4th of July barbecues, doing the grocery shopping, going to places where there are known potential exposures in an area with ongoing community spread, that's going to undo, in my opinion, findings of work-relatedness. So very, very difficult to find these cases to be work-related, and the exact same standard, the exact same criteria apply in Virginia as they should everywhere else in the country. And we're having a little fight with California about that right now, trying to get them back in line. But the rules are, and the law is, all states need to be following this exact same criteria for record keeping. So one other area where there is generally on the next slide should be consistency. Here's just a pictorial that you can use. We've got a set of flow charts for COVID-19 record keeping for recording, as well as COVID-19 reporting. Those are available on our website, and I'll include a link to that when I send out a copy of the slides and the recording of this webinar. But on the next slide, we do talk about reporting, and that's the typical reporting of hospitalizations and death cases. The states are allowed to do different things for reporting. So far, Virginia OSHA has not done that, except for the thing that we talked about before, with the 3+ cases within 14 days have to be reported to Virginia OSHA. Otherwise, hospitalizations and death cases are being handled exactly the same as OSHA handles them. And here's a limitation. Right now, unless OSHA issues some different guidance, and I don't see how they could because the rule requires this pretty clearly, for a hospitalization to be reportable to Virginia OSHA, the employee must be admitted to the inpatient service of the hospital within 24 hours of the exposure that caused the illness. And I say extremely unlikely here. To me, I think that is essentially impossible in the context of COVID-19. What we are seeing from an epidemiology standpoint, from a science standpoint, is that employees do not experience symptoms within 24 hours of the exposure that causes the illness. I've read instances where there is almost 100% false negative test rate. If you are tested within a day or two of the exposure that caused the illness, you're not experiencing symptoms, you're not even testing positive. So it would strike me as nearly impossible that you could contract the illness and already be experiencing such severe symptoms that you're being admitted to the hospital within 24 hours. So in my mind, it is essentially impossible to have a reportable hospitalization for COVID-19. And by the way, you also still have to meet that confirmed case by a positive test, and work-relatedness, and this 24-hour period. So really there should be, I think, no hospitalizations that have to be reported. Fatalities, though, have to be reported if the employee succumbs to the illness within 30 days of the exposure that caused the illness. So again, confirmed case, work-related, and the employee succumbs to the illness within 30 days. That is happening a lot. We see plenty of instances where employees are sick for longer than 30 days before succumbing to the illness, but it's another trigger here to look out for. So reporting should be really, really difficult to meet those criteria, and recording should be really difficult to meet those criteria, but look out in this VOSH rule for some of those new notification requirements. So interesting stuff there. With that, I'm very pleased to turn the program over to Susan Wilcox at Safety Resource Associates. I'm very pleased to be joined by Susan today and to have developed a very nice partnership over the years with Susan and Ed Bullinger, the founder of Safety Resource Associates, a really top-notch Virginia-based environmental health and safety consulting organization. We've had the opportunity to work with them for years on a variety of different projects, but lately doing a lot of work together on COVID-19 related issues, collaborating on developing exposure control plans and training and helping our clients across all industries manage this crisis in the workplace. So with that, Susan, take it away.
Thanks, Eric. Good afternoon, everyone. Thank you for having me. As Eric mentioned, I am a health, safety, and environmental consultant with Safety Resource Associates. I am both a CIH and CSP. Doing health, safety, and environmental is the only thing I've ever done. So I do have several decades now of experience in that field, as well as managing the COVID-19 pandemic with essential businesses over the past several months. So I am going to give a perspective, a boots on the ground perspective, if you will, from the front lines of essential businesses who've been managing the pandemic in their workplace and facilities from the beginning, like March, April this year. We've learned a lot from our experience, and you're very fortunate you're going to get to benefit from that experience and our learnings from that. So I'm going to present challenges that you might face and tips and strategies as to how to deal with those challenges. Some that work, and I'm going to talk about some that don't work as well. Okay, so the ultimate and overarching challenge, if you will, and that we're all facing is keeping COVID-19 out of the workplace. This can be particularly challenging in areas where you have geographical community outbreaks, right? So the challenge then becomes preventing COVID-19 from coming into your facility because it's all around your facility and your workplace. As states and localities open up, we find ourselves in a challenging position where we should be more alert than ever, because as states and localities open up, we have more exposure, cases are rising, but what we find is that caution fatigue has set in. So after dealing with this for so many months, we find that it's sort of like a battery. Like in the beginning, we were all supercharged and on high alert, and more than willing to be abundantly cautious, to do whatever it takes to do the preventative measures. But now, over time, people have tired of this, and there's sort of an all-thing mentality that's set in. So we're going to have to be challenged with proactively managing that. We're also faced with a multi-generational workforce for a number of reasons, mainly economic reasons. We have multi-generational families working together, living together, carpooling together, and that presents some unique challenges where this pandemic is concerned. Probably the most important strategy I'm going to share with you, or one of the most important, is doing case and contact tracing. And I know you're thinking, but wait a minute, the standard states specifically that the employer is not required to do contact tracing, and that's correct. However, based on my experience, I'm going to strongly recommend that you do your own tracing for both your cases as well as your contacts, and there's a number of reasons for that. The health department is a bit overwhelmed, right? Time is of the essence here, and while they may eventually get around to doing contact tracing of your workplace, if there's a test positive employee, it can be at best 4 or 5 days is my experience. It can be weeks, and time is of the essence, and in the meantime that employee can be infecting other employees. Also, the health department does not have frontline access to the same information that you do. And they have limited resources. They really are not staffed to prepare to deal with this pandemic. Also going to recommend that you not rely on temp agencies. I know that legally, the temp agency is responsible for their own employees. And while that's true, you may find that they do not share the same vested interest in your workplace that you do, and they have limited resources as well. In one example, we could not get the temp agency engaged. I finally gave up and found out a month or two later that their entire staff had been taken out by COVID-19, and they were very apologetic, and we reestablished a very positive relationship. But nothing creates value like ownership. Take ownership of your workplace and your facilities. And thirdly, SRA Associates has developed a tool that I found really helpful to do your contact tracing for both case and contacts. It's an Excel spreadsheet that was used by one of the health departments in another state that we took and revamped and revised and created an excellent tool for tracking those cases. It really helps you stay ahead of the curve and prevent outbreaks in your facilities. When you are trying to track a lot of employees at one time, and there's definitive timelines associated with important data points like onset of symptoms, last day in facility. That data can be really difficult to manage if you don't have a tool to help you do so. Okay, so one of the reasons you need to be really on top of it is a return to work policy. So strongly recommend that you have a well thought out and agreed upon, really important, agreed upon return to work policy. Of course, we want to follow the CDC guidelines, which they are, as you know, currently relying on a symptom-based strategy and have pretty much abandoned their test-based strategy. Important that you consider each case on its own merit. Rarely does a case fit into the black and white neat little box as it's described on the CDC website. Each case has its own nuances, its own characteristics and variabilities that are going to come into play. So really important that you review each case individually and stay away from blanket boilerplate policies. We learned this from experience, right? In the beginning, it was okay, if you've been in contact with someone, you stay out for 2 weeks. And then 2 weeks, you let them come back to work, or they come out of isolation. However, what have they been doing those 2 weeks? Just because employees are directed to self-quarantine doesn't mean that they do. Many of them went to work for other employers because they couldn't be without a paycheck. They may be living with someone who's got the virus. So really important that you look at each case individually and interview each employee to get the details ironed down before you let them return to work. There are times when it makes sense to go above and beyond the minimum CDC criteria, when it makes sense to do so. What we are seeing now in Virginia is testing is readily available, right? Anyone can get a test. It may take you a day or two to get the test, but nonetheless, testing is readily available. However, there is a lag in getting test results because we're doing more testing, the labs are a little backed up. So unless you do rapid testing, which is offered on a very limited basis and triaged based on how sick you are, You might see a minimum of 5 to 7 days to get test results. It can be 10 days, it can be up to 2 weeks before that person's going to get their test results, right? So what can happen, given the fact that we're now going with the symptom-based strategy for return to work, is an employee can recover based on the symptom-based recovery strategy 2-3 days after they get their test result. And if you let them come back to work immediately, the perception on the shop floor or amongst the workforce is that they came back way too soon. And that's a really difficult perception to deal with. Panic can set in very quickly. You can have entire shifts walk out. So sometimes it makes sense to hold an employee back a little bit, maybe an extra long weekend, to give everyone a sense of comfort that they've truly recovered and are no longer contagious. Also recommend that you have a designated gatekeeper. Really works well to have one employee or maybe 2 employees working closely together, managing this data to ensure that your policies are being applied consistently. So if there's one concept or slide that you leave with today, I hope it's this one, and that is physical distancing is the antidote to quarantine. I'm going to say that again. Physical distancing is the antidote to quarantine. So the definition of close or direct contact is being within 6 feet of someone for 15 minutes or more at the same time, not spread out over the day. Within 6 feet, 15 minutes or more, as opposed to casual contact. Casual contact, I bumped into them in the hallway. I bumped into the grocery store. I stood beside them at the coffee pot this morning getting coffee. That's casual contact. That doesn't count. So contact tracing is based on direct or close contact. So the more you create and enforce physical and social distancing in your workplace, the less impact it will have on the workforce when you have an employee test positive. The two are directly related. If you are not enforcing physical distancing in your workplace and you have a test positive, you can take out an entire shift. I've seen it happen. And then it's kind of like, oh shoot, wish we'd been doing that a little better. So if you can create, wherever feasible, that 6-foot distance between employees and enforce it, it's going to go a long way to minimize the impact on your organization when you have an employee test positive for COVID-19. Okay, health screening. So I want to talk about the first form of health screening, which I highly recommend and have found to be highly effective, is a health screening form. This is a form that Safety Resource Associates developed. It's basically 2 questions. I'm going to over-summarize here, but for the sake of time and words, but it's 2 questions. The first one asks the employee, are they experiencing any symptoms? And of course, we have listed all the symptoms currently recognized by the CDC. They circle yes or no. The second question is, have they been in contact with anyone who has either tested positive, suspect, or been in quarantine? The employee completes and signs or initials this form pre-shift. Of course, the idea being if they circle yes to either one of those, then they really shouldn't be there. And you'd be surprised at the effects this will have. It accomplishes 3 things. 1, it prompts the employee to stop and think about the symptoms they may be experiencing. You know, right? We all come to work sometimes with a headache or a runny nose without really thinking about it. And this prompts the employee to stop and think, wow, I really have had a killer headache for 3 days that I've never had before that won't go away. And that's when you realize, hey, you know, probably shouldn't be here, should probably go get tested. Also, having the employee sign or initial the form encourages integrity. There's something about signing it and signing their name. They know it's enforceable. They're more likely to be more forthcoming about their situation. And thirdly, it creates very important documentation that can be used for human resource purposes. It's also a great way to show Virginia OSHA or the Department of Health, if they come calling, and they will, trust me, that you are going above and beyond to make a good faith effort to keep your employees and facilities safe. The other very popular form of health screening is temperature checks. And And while that sounds wonderful, doesn't it? I'm just going to go on Amazon. I'm going to buy a $14 no-touch thermometer, hold it to the employee's head, and that's going to be a great way to screen out COVID. Not so much, based on our experience. There's a lot of logistical issues with that. If you try to do it at the entrance, you have bottlenecking at the gate, weather issues, cost. The equipment is expensive. Most of it is not designed. You know how we tell employees, don't bring your home coffee pot into the workplace because it's not UL rated for industrial use. Same sort of concept. That thermometer you're buying off Amazon or wherever is probably not designed to be used 200 times in a couple of hours. It doesn't hold up. It falls out of calibration, goes through batteries like crazy. So a lot of costs associated. Even if you decide to contract it out, it's very expensive right now. Depending on what geographical location, you can pay anywhere from $45 to $75 an hour for people to do this. You'll get false positive and negatives for a variety of reasons, and those have to be rechecked. So now you have a snowballing effect of your bottleneck at the gate. The safety of the person taking the temperature is an issue, and they need to be fully suited with a face mask, a face shield, and it's tough to find people willing to do that, particularly if you've had positive cases in your facility. It does have a placebo effect. It does give employees and management a sense of security. However, it doesn't necessarily generate the value-added data to combat the logistical issues and the cost issues associated with it. And because of the placebo effect, once you start it, it's difficult to stop, right? It's difficult to defend, okay, we're not going to do this anymore, because you don't want to necessarily share that it really hasn't been very useful, but it's difficult to stop it as well. So some things to really strongly recommend you think about before getting into doing temperature checks. There's also questions of how long do you keep the records? That's a good question. I can't answer it. Maybe Eric can, but right now I'm advising clients to keep it. Just hold it for now till we figure this out.
Yeah, so that's right, Susan. We've been back and forth with federal OSHA on this issue, and OSHA and VOSH have the same access to employee medical records standard. Here's the lay of the land with federal OSHA right now. They started out of the gate during the pandemic saying, recorded body temperatures and recorded symptom questionnaires documented, actual body temperatures and answers to symptom questions are employee medical records under 1910-1020, which means they'd have to be kept for the duration of employment plus 30 years. So a multi-decade record preservation requirement. We looked at it and we believed that was wrong, and we challenged OSHA on that and got new guidance that correctly, we think, asserts that it's only a medical record covered by that 30-plus year record preservation requirement if the record is created by a medical professional. So if you are farming this health screening out to a third party, have registered nurses coming on to do the temperature screening and ask the questions, or a technician or something like that, then it could be covered by the record preservation requirement. But if you're doing it yourself, right, an HR manager, a frontline supervisor, somebody like that is doing it and creating the records, it's not covered by 1020. It is, however, covered by the Americans with Disabilities Act and is required to be maintained for 1 year in a confidential manner. So either way, the record that you're potentially creating creates a preservation issue and perhaps a preservation nightmare. So our recommendation has tended to be, do the exercise, document that you are doing the exercise, but don't document actual body temperatures and don't document actual answers to symptom-based questions. Instead, just a yes, no, pass, fail, enter, do not enter. So, right, we're not trying to model or trend the data. We're just trying to make sure it's okay for somebody to enter on that occasion. So keep a log, as simple as that, and you should be okay.
Absolutely. Thanks, Eric. So with that, I'll back up to the health screening form, because I failed to mention the document retention issue of that as well. Again, what I'm telling clients at this time is just keep them, because I'm not sure where we're going to land on this. But again, it is a simple yes or no. You aren't documenting answers to their questions. You're using it as a screening tool. And I don't know, Eric, do you want to speak? Does this fall under the same category in terms of document retention?
I think it does. I mean, if the question is, are you experiencing cough, shortness of breath, and they're answering specific questions about specific symptoms, I think it's definitely covered by the ADA for a 1-year requirement. And if it's being documented by a medical professional, it could be covered by the OSHA and VOSH standards as well.
Yeah.
So that's something to consider.
Yeah, and unfortunately, and this is an unfortunate situation, but it's in your best interest to hold on to them for a while. We have found them to be very helpful when employees misrepresent their situation and you find out later they were not being truthful about their symptoms. You do have that documented. Okay, so I'm going to move on then to employee morale, which is a challenge, right? And that will significantly evolve and fluctuate depending on the situation. If you're in a facility or workplace that has not been impacted by COVID-19, business is good, no one's tested positive, morale's going to be very high. People feel lucky to have a job, they're lucky to have their paycheck and benefits if it's available. However, it can quickly go downhill if someone tests positive and they become directly impacted by COVID-19. So you need to be proactive about that, just in the same manner in which you would have processes in place to ensure adequate communication during any crisis, right? Have your processes lined out, who's going to communicate what, and try to stay ahead of it to combat fear and panic, which can set in very quickly. Along those lines, one thing you can do is try to ensure that your management and leadership portrays a sense of calm, right? I mean, this pandemic has challenged the most experienced high-level, managers that have been out there. We've seen a lot and done a lot, but this has even challenged their sense of calm. And it's really important that they try to stay calm in the midst of this pandemic. So your strategy for doing that is over-communicate. I feel like a broken record, but I can't tell you enough how important it is to over-communicate. Be seen and be heard on the shop floor. That goes a long way to making employees feel like we're all in this together. It's one thing to say it, but if they don't see you out on the shop floor, perspiring in this 100-degree heat with your mask on, it doesn't have the same effect. That goes a long way. Makes employees feel really good that you're on top of it and that we're all in this together. And thirdly, be a good listener. I've been surprised sometimes. I get a chuckle out of an employee, they'll be in panic mode, or a manager, a very high level leader will be in panic mode and come to me just really needing to vent. And all I do is listen very calmly and help them sort of think through and talk through some of the irrational fears they're having at that moment. And later that day or the next day, they're like, thank you so much. That was so helpful. When really all I did was listen. Nothing changed. I really didn't do anything other than listen and try to help them sort of think through their thought process of some of their irrational fears. So along those lines, this is a tool that SRA put together. This one I like to call employee growth during a pandemic. And it's just a schematic that you can post around your work site to help employees sort of deal with all the emotions that they're feeling and anxiety and stresses and pressures of this pandemic. And then the next one is a similar schematic that we put together for leadership. And I like to call it, how do I want to lead during this pandemic? And again, it helps leaders and managers think through their leadership strategies as we go through this. So that is all I had today. Thanks again for having me, Eric. Want to let everyone know that Safety Resource Associates has a lot of experience dealing with this, and we are ready and available to help you in any way we can. Thanks.
Thank you, Susan, and thank you, Jennifer, for participating with us today. We've consumed a lot of your time today, and we appreciate that. We have collected, though, throughout the program, a ton of questions, which is totally understandable for a brand new rule like this. Our plan is to take those questions and organize them into a sort of frequently asked questions document. We're going to get together, brainstorm, and give our best answers to those in writing in a document that includes all the questions and all the answers, and that's going to be posted in a couple of different places. One is on Conn, Maciel, Carey's website. We have a COVID-19 task force resource page where we've got all kinds of helpful information, including an FAQ document we've had running since the beginning. We'll have a separate section on the Virginia Emergency Temporary Standard where all of the FAQs from today will be included. It will also be posted on Safety Resource Associates website. That's vasafetyconsultants.com. And then you can also find other resources on there. I mentioned before our injury and illness record keeping and reporting toolkit with flow charts, how to record, work relatedness questionnaires, all sorts of helpful information, including links to this webinar and other webinars we presented, and lots of articles that we're producing on a seems like a daily basis with all the different updates we're seeing from CDC, OSHA, and otherwise. And then, of course, I'm sure that you could sense from all three speakers today, we're safety enthusiasts. We love talking about this. We love being a resource for all of you. So if you have any questions, please don't hesitate to reach out. We will follow up with an email that includes a link to the recording of this, the slides, and some of these other resources, and also our contact information, which is included in the slides as well. But don't hesitate to reach out if you have any questions that were not addressed, or you think of any other questions, or as you start to dig into this and try to meet these deadlines that are coming up very soon. We're available to you anytime, and we appreciate your time today, and good luck and stay safe out there.